Hi guys, I'm updating you guys again because there's a few things I wanted to go over. I had a couple people that asked me about Lyme disease and what to look out for because it is preventable and there is something you can do if you get it right away. 3 stages to Lyme. I think I've gone over them before, but the first stage is the most crucial. If you can find out if you don't have that bullseye rash, if you do, go to the doctor right away. If you see the tick, try to keep the tick. I don't think it's going to make a difference. I think they'll believe you anyway. Depends on the doctor. But go in right away, and I think they'll put you on some oral meds for about a month. And you won't have it. It won't be a permanent thing. The best way to notice that is not the bullseye rash, because about 50% of the people have it, and then 70% of the patients that come forward and have a positive Lyme don't even recall the rash in the first place. So in the first months to 6 weeks following a bite from an infected tick that has Lyme and then a few other of the co-infections, it may include flu-like symptoms. One of them is just a general feeling of illness, chills, fever, sore throat, achiness, swollen lymph nodes, and it will last for quite a while. Unlike a flu that would go away in about a week or two, it will continue. So it's hard to detect because you think you actually have the flu. Oh, that's just beautiful. That's a nice addition. Okay. So after those symptoms pass, then you start getting into the second stage, and that's where it's starting to become more permanent. The spirochetes are dwelling into you. So if you're out camping and you either that night or the next few nights all of a sudden come down with the flu, and especially if the flu is not going around in your house, which I don't know why you go camping anyway. That's dangerous for your health, I guess, if it's not, but I wouldn't do it. I would definitely go into the doctor and say, look, I was just camping. I may or may not have the flu, but I might also have Lyme disease. There's the test that they can do, and it's a very preliminary test, and it will show the I hope it's correct. I think it's the IgG, which means the initial infection, and the IgM shows it's still going long term. So anyway, if I have that wrong, my brain's not figuring it out correct now. But either way, there's a test they can do, or they can just put you on the meds and you'll be fine. So it all depends on the doctor. My doctor's, I'll have to get her name. Stephanie is her first name, but she's with Dr. Shaw at the CIDS. It's Clinical Infectious Disease something. I don't remember. I want to say associates, but it's not. It's CIDS. I don't remember what it stands for now. But Dr. Shaw is the main doctor there. I see the PA, Stephanie. I think her last name is Wallace. I'll have to look it up. But she is amazing. I have a blog just about my story, and it was very hard to describe the experience I had with her because she really cares about my well-being and me getting better, and she's amazing. It's really good to have a doctor that's on your side. If you don't, you just better have a good support system because it's tough. And I do. I have both. So after those symptoms pass, the infected person usually develops muscle and joint pain, which can be severe. It can be temporary, and it can also manifest in different areas. There could be shooting, burning, and prickling sensations, as well as numbness throughout the body. Then there's neurological problems, such as facial paralysis or Bell's palsy. That may occur. It didn't occur to me. I've had a lot of eye twitching, but I had that kind of before, so I don't know. In addition, there's encephalitis and cognitive dysfunction, like short-term memory loss. There's also panic, anxiety, or depression can be caused by this virus. It does mess with your brain big time. You can have brain fog. You can have memory issues. You can have digestive system issues. There's a lot of things that it does. I am and have been for years on 2 different antidepressants, and I know I'll always have to be on them. I tried for years to be without and to try different anxiety things, and it's just not in my makeup to go without it, and I'm completely fine with it. I've been through enough counseling and working at home and self-help things that have brought me to a point where, okay, I see it coming and what do I do? But I've known because I've had, with Robin Williams' recent death, I think it was 2 days ago, with his clinical depression, I completely understand that. So I've been on medicine because I never know when my lows will hit. And a lot of it is through my celiac disease. When I have a little bit of gluten in my body, it would always make it worse. I don't know if you guys can take me serious with this in my head, but I can't even look at my picture because it's still right there. Hold on, I gotta make it more. Hold that piece of hair back. Give it something to do at least. There we go. Okay. So, it's never serious around here. It's okay. Hi, honey. So, I don't know what I was saying. Oh, I do. The other things that can happen, that since this is, I'm trying to think, it was called, Lyme disease is called the great imitator. And it's true. That's very true. You can have like coughing and shortness of breath, unexplained fevers, chills, and sweats. And for me, I have a hard time regulating my body temperature. You can have bladder inflammation, fatigue. Fatigue is a big, big one, and a lot of people misdiagnose that as just chronic fatigue. Chest pain and heart palpitations. I had that, and I actually was recently hospitalized for the chest pains. They told me my EKG in a certain way was dropping instead of going up. So I can't remember what it's called, but we're going to have to follow through with that and after my Lyme's treatments to see if that's still a problem. You can have double blurry vision, pain, flutters in your eyes. Photophobia is an abnormal sensitivity to light. Hair loss, which I did have that one, and I did have photophobia. I had sensitivity to light. Fever, that kind of goes along with the unexplained fevers. Rash, that's the bullseye rash at the site. Difficulty swallowing, swollen glands, sore throat, swelling around the eyes. Unexplained weight loss or gain. Mine was gain, and now it's starting to go to loss, but I think that's because I'm on my treatments now. Buzzing, ringing, or ear pain. That one I have really bad, especially in my left ear, and we're hoping that clears up. It's getting a little better. It's not as excruciating as before. There's difficulty eating, nausea or vomiting, diarrhea or constipation, tremors, eyelid facial twitching, which could be Bell's palsy, joint pain and swelling. That's a big one. My joints didn't even know half the joints I had in my body could hurt that bad. That's a big one for me, big time. That and the fatigue and the chest pains are my three big ones. You can have, I think I said this one already, bladder problems, pelvis pain, for men, testicular issues, neck creaks or cracks or stiffness. Now that one is another one I have too. Instead of my neck cracking like it would before if I moved, it almost clicks. It's a different sound and a different feeling. It was really weird. Joint or back stiffness. I've always had that. I have scoliosis, so that one, it just kind of made it worse. Muscle pain or cramps. Lots of muscle pain. I had that. Insomnia. I had that for a while. TMJ, jaw pain. I have that. Headaches. Of course, a lot of people have a lot of these symptoms too, so this is why it's really hard to diagnose Lyme disease. Tingling, numbness, poor balance. I have that one too, and the previous one. Difficulty walking, seizure activity. I have not had seizure yet, thank goodness. I'm not that far progressed. Stabbing sensations. I had that, and it was mostly in my chest, and I thought it was anxiety, and come to find out it was happening at the calm times, so we're still not sure, but hopefully these will clear up. Dizziness, personality changes, mood swings, irritability, depression, confusion, anxiety, difficulty concentrating or reading. A lot of those are all neurological, and it's called Lyme, and it really, if I'm saying that right. Oh my word, your hair is soaking wet. How'd you do that? With that? Okay, go find a brush. So I have a lot of that, and this is another reason. A lot of these things on here, we're wondering if I've had Lyme for longer, and the camping trip in October may have something happened that encouraged it all to kind of come out and explode and go crazy. So we'll find out. If my treatments take care of it here pretty soon, then it will be October that I contracted it, and then if not, then I'll be dealing with a longer battle, and it will mean I contracted it as a kid. So we're finding that out. But we're pretty sure, about 80% sure, that it was this last October when I went camping. There's menstrual irregularity, loss of libido, trouble speaking, disorientation. So those are some of the things, some of the bigger things that can happen. And when you put a lot of these, is just like difference here and there, different things. But if you put a lot of them together, which I have almost all of these on here, which I'm sure everybody can look and say, oh yeah, I have that, I have this, I have that. That's just proves how hard it is to diagnose Lyme. So anyway, some of the things, actually no, I'm going to stop here because my video is already pretty long. But that's just the warning signs for people. If you think you've been bit, or if you think you've got the flu after just recently going outdoors or camping, especially if you're in the Midwest, East Coast especially, United States. I don't know exactly where in other countries because it is worldwide. It's in Canada. It is in Australia. It's definitely in Asia and Europe. It's a lot more cases. I think it's China that has the most cases as of now. And there's a lot more deaths there from it than we have. But here on the West Coast, we're starting to see it more in California, definitely in Arizona. And not too many here in the Vegas Valley, but their numbers are starting to rise everywhere. So anyway, I will stop and do another update here too. So there'll be a couple videos probably today, because I don't know when I'll feel better to do them. So, all right, thanks.